So in this video, I'm discussing a history for MRCPCH. The task is that 14-year-old Ali went on mountain trip where there was snow. Okay, suddenly he became pale. Faint fingers is blue. He is known case of migraine on treatment. Take the history from him. Diagnosis is Raynaud's blue fingers. Okay, so he goes to mountain trip and suddenly become pale and blue finger. So Raynaud's phenomenon, blue finger history, how can we tell that? First onset course and durations, when it started, how long you are suffering this condition, is that anything make it better, anything make it worse? Okay. Then all fingers or not, all fingers affected or unilateral, bilateral, both hand or one hand, any other color changes, pins, needle sensations, any other concern like any unusual features, chronic disease. Then go the systemic review from MSK, skin spots, lumps, neck swelling, dilated vessels on face, muscle pain, bone pain, joint pain, hair, nail, and finger swelling. Then fever, weight, activity, sleep, general features, FWASL. We are asking. Then CNS from any fits, abnormal behavior, seeing something not real, vision concern, red eye, abnormal gait and hearing. From chest, any chest pain and bug, CBS, any heart race and fainting, heart racing and fainting, GIT, any tummy size pain, throwing up, poo, oral soreness, swallowing problems, urinary and any pee, through the urine and blood pressures, hematology is any pallor, bruising, bleeding, bug. Endocrine, thyroid, addition, celiac, diabetes, mellitus includes. So normal, all history take is normal. Past history, 5TIU, any trauma, traveling history. So traveling history already find. Treatment history, blood transfusion history, any previous any admissions, if any admission occur, that any ICU admissions, any drugs is taking regularly. Remember migraine drug, our history tracks the child is taking migraine. Migraine drug precipitate this condition. Some drug precipitate Raynaud's disease. Okay, then pediatric history as usual, puberty, smoking, alcohol, OCP, normal, when vaccine allergy, nutrition development history, a plus growth chart. Then family, all family history will take modifications, family history of any migraine, social, psychological. Now I'm taking to discussing about the Raynaud's types. Raynaud's is primary disease and secondary is phenomenon. So primary disease usually no cause, less severe, needs no treatment. But secondary phenomenon associated with a cause like first of all autoimmune conditions, scleroderma, SLE, rheumatoid arthritis, immunoglobulin A nephropathy, and Sjogren post-COVID. Then injury to hand and feet, vibratory jobs. Example, drilling machines. Some drugs, example, migraine treatment, OCP, beta blocker, chemotherapy, cold medications containing ephedrine, pseudoephedrine. Some chemicals like smoking and excess caffeine. Then clinical pictures is that enough for diagnosis plus minus dermoscope to examine the blood vessels. First, the finger become pale, then blue for short time, then increase blood flow to the fingers, then red, numb, burning sensation, pin and needle, and difficult movement. I'm again telling the clinical pictures of Raynaud's phenomena. That is enough for diagnosis. Plus minus dermoscope to examine blood vessel. First, what happened? Finger become pale. Okay, then blue occur for short time, then time increase blood flow to the finger, red occur, then numb, burning sensation, pins and needle, and difficult movement. So first pale, then blue, then red, then pins and needle, numbness, and difficult movement. Treatment, what we give the Raynaud's phenomena, keep your hands warm, regular exercise, decrease smoking, decrease caffeine, avoid OTC containing pseudoephedrine. Avoid stress. Nifedipine, that is calcium channel blocker, if severe, surgery to cut the nerve supply to the blood vessels, treatment of the primary conditions. Again, I'm treatment options are repeating. First, keep the hand is warm, regular exercise, decrease smoking, decrease caffeine, avoid OTC containing ephedrine, avoid stress, then nifedipine, calcium channel blocker, if severe, surgery to cut the nerve supply to the blood vessels, treatment of the primary conditions. When to see the GP to treatment. That is any severe interference with daily activity. Then worsening symptoms, unilateral, child less than 12 years associated with joint pain, skin rash, or muscle weakness. So this is all about Raynaud's phenomena, history, blue finger, remember, blue finger, blue finger. Then we can easily find out the history. Thank you very much.